What to do when your HPV test is positive? Receiving a positive human papillomavirus test can be concerning, but it is important to understand what this means for your health. A positive test indicates that high-risk types of HPV have been detected in your cervical cells. However, it does not mean you have cancer. Instead, it suggests an increased risk for changes in cervical cells that could lead to cancer if not monitored or treated. So, what should you do next? First, it is crucial to understand your risk and follow up with testing. If your HPV test is positive but your Pap test shows normal results or only minor abnormalities, your healthcare provider may suggest repeating the HPV test or doing co-testing in 1 year. This is often recommended if you had a negative HPV test in the last 5 years and your current risk is considered low. If your Pap test shows abnormal cells alongside a positive HPV test, further evaluation is typically necessary. This usually involves a colposcopy, where your cervix is examined closely with a special microscope, and biopsies may be taken to assess any abnormal cells. For those with high-grade cytology results and a positive HPV test for HPV type 16, which is the highest risk type, treatment may be recommended without waiting for biopsy confirmation. This treatment often involves a procedure called loop electrosurgical excision procedure, or LEEP, which removes abnormal tissue to prevent progression to cancer. Patients who have not been screened regularly and have high-grade abnormalities with a positive HPV test may also be candidates for immediate treatment. Long-term surveillance is also essential. After treatment for cervical precancerous lesions or cancer, continued monitoring with HPV testing or co-testing at 3-year intervals is advised for at least 25 years. This is because the risk of recurrence or new lesions remains elevated over time. Even after treatment, regular follow-up is critical to detect any new or persistent HPV infections or abnormal cell changes early. For individuals aged 25 to 65, regular cervical cancer screening is recommended. This can include primary HPV testing every 5 years, co-testing with Pap and HPV every 5 years, or Pap testing alone every 3 years if HPV testing is not available. It is important to note that HPV vaccination does not eliminate the need for screening, as it does not protect against all high-risk HPV types. Finally, always consult your healthcare provider to discuss your specific test results and risk factors. They can help you determine the best management plan tailored to your needs. Do not delay follow-up appointments or ignore abnormal results. Early detection and treatment of cervical precancers significantly reduce the risk of developing cervical cancer. In summary, a positive HPV test signals the need for increased monitoring and possible further diagnostic procedures. High-risk cases may require prompt treatment to remove abnormal cells, and long-term follow-up is crucial for maintaining cervical health and preventing cancer. Regular screening remains a cornerstone of cervical cancer prevention, even after receiving the HPV vaccine.